Not all medical schools teach how to do a good sexual history. A lot of doctors are too shy and dance around the subject and only kind of bumble themselves into it eventually. There's a lot of data suggesting most doctors go in and say, okay, and how's your husband? And make that assumption, even the person may be gay, and then they get turned off. And we were taught specifically how to be open-minded about that. But also in my medical school, it was a combined BS-MD program, and they got us to do some medical stuff early on. They threw us in the deep end of the pool, and they said, you're going to interview people who don't have vanilla sex lives, and you're going to be graded for it. All of us people just coming out of high school, working so hard to get A's and trying to get into med school, achieve. We're like naive Midwesterners, probably mostly sexually inexperienced people, and all of a sudden we're having to perform by asking questions, receiving in gentle manner, and be able to have people open up and share stuff that they don't know if they trust you and stuff like that. That's what I meant by it was a little different. My couple was swingers and participated in orgies, and I hadn't met anyone or talked to anyone that had done that before at that point in my life. The idea is get that over with. But also, when we got to medical school, I think the standard sexual education is like, this is the clinical laboratory. We're wearing white coats. Here are the subjects. They're going to lie in the MRI machine while they masturbate, and you will see. Here's a little video scope, and you will see the changes in the vagina lifting and the cervix tightening. And I'm like, what? That is not really what you should be learning. That was the different experiences in how they teach sexual health to doctors in standard medical school versus our program in interviewing. You never know what a doctor has been taught in medical school, but it's probably more likely the clinical stuff. Most doctors have to gain the conversation skills.
When I learned about swingers, it was just a random YouTube video, and they were like in Spain visiting. That was part of their vacation, visiting clubs around Spain. But how was it for you, like learning about that, like on real time with a person in your face, and you're the doctor. You cannot go like, oh my God.
Yeah, I know, right? Exactly. I went to a Catholic high school. There was a bit of a religious, prohibition about masturbation, anything other than, missionary style sex. And I don't think that they did very much sexual education. They're just like, these are STDs, don't get them. I'm an adaptable person. When I say go off into the deep end, I'm one of those people that, there was a YMCA and they did have a 30-foot diving board, and I was one that says, I'm going to do this. Even as a high schooler, I'm going to do this. I'm going to jump off the 30-foot diving board. I had a little bit of a wild life in end of high school. I didn't necessarily click with the Catholic education way of looking at things. I felt like I was open-minded enough just to handle it. I had friends who were gay, and so everybody was open-minded to that there are ways to do things that aren't vanilla.
How did you get those conversation skills when it came to asking the questions and keeping a poker face when things were new to you?
We spent a lot of time in motivational interviewing in my years. The very first introduction was, they gave us a very canned sentence. You feel this because of this, and you're reflecting back to the person what they just said in maybe slightly different words. That was the very ingrained fallback, just be able to reflect back. So you have a expanded non-monogamous lifestyle. Then boom, you just switch the words around and just gave it back to them what they just said to you. They feel like they were listened to, that they were heard, and that they were valued. That is just the standard. Even if you're stressed, you can manage to come up with that. Even if you're like, whoa, never heard of this before. That also worked well with the veterans coming back from war, and they've had some really horrendous experiences. The one guy said that he was crawling on the ground and there were rivers of blood. I wanted to go, oh my God, but you can't. You have to be that steady person that listens to them and hears them and receives it without freaking out, because that's why they hold it back in. It's because they're afraid that they'll be freaking people out or hurting people just by telling them. Just the different experiences in med school that might be considered traumatic to go through as a doctor, it gives you that tough outer coat or that skill of handling things.